Hello and welcome. Today I'll be speaking to you about migraine, a type of headache. I have other videos on headache and you could watch them afterwards. It's important to mention here that these videos are not for you to become your own doctor, but they're things you can learn and know, at least take some steps. Okay. So what is migraine headache? It's a type of headache that occurs with throbbing pain on one side of the head. Typically occurs in females more than in males. I'm not saying it doesn't occur in males, but more likely to occur in females. Broadly speaking, we could look at migraine as two types, or classified as two types. Migraine that occurs with an aura, migraine occurring without an aura. What's an aura? An aura is a warning sign of an impending migraine. In other words, the patient somewhat knows that something is about to happen. So some patients have migraine that comes with an aura, others have migraine without an aura. What's the typical duration? Typically, it will last 2 hours to 3 days. And just a quick mention on menstrual migraine. This is the type of headache that occurs in patients before and during their period. We don't know exactly what causes migraine, but you could look at the family history. If there's family history where the mother's got a migraine and then you have a daughter that has got a migraine, there could be some family predilection or predisposition to migraine. And then also look at triggers such as stress, caffeine use, and then the starting of a menstrual period. What can you do when you have symptoms of migraine? Number one, you could be in a dark room. In other words, put off the light and be in a dark room. Number two, you could hydrate adequately. Number three, you could engage in exercise. Number four, you could sleep adequately. Number five, you could reduce caffeine use. Number six, you may use simple analgesics. But if these do not work, it's important to see a doctor where you'll be placed on a class of medications referred to as triptans. And then it may be necessary to give you medications to suppress vomiting if you're vomiting. And then for patients who are intolerant to triptans, or triptans are contraindicated or ineffective, they may be placed on a class of medications referred to as gepants. So migraines cause throbbing pain, usually on one side of the head, typically occurs in females. If you have these symptoms, there are steps you can take and there are things the doctor could do for you. I hope you've learned something. If you have, like, share, and subscribe.